Hello, and welcome to Celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the Celiac.com forum online at celiac.com. And now let's move on to the latest Celiac.com news. Study on celiac disease prevalence in children with chronic diarrhea. Celiac disease is usually associated with digestive problems like chronic diarrhea, but it can also affect a child's growth and development in subtle ways. This study, conducted at a hospital in Peshawar, Pakistan, explored how common celiac disease is among children with long-term diarrhea and what signs might help doctors identify it sooner. The goal was to find out how frequently celiac disease occurs in children with chronic diarrhea, defined as loose stools that last for weeks. While diarrhea can have many causes, celiac disease is sometimes overlooked. Early detection is essential, as untreated celiac disease can lead to poor growth, nutrient deficiencies, and even increase the risk of certain cancers. Researchers examined 165 children under age 14 who had been admitted to the hospital for chronic diarrhea. Children were excluded if they were already on a gluten-free diet without a diagnosis, had bloody diarrhea, or had previous abdominal surgery. Each child received a blood test to check for celiac-related antibodies. The study also gathered data on age, gender, weight, height, and family history of celiac disease. Researchers then compared those who tested positive to those who didn't to identify any patterns. Out of the 165 children, 22 were diagnosed with celiac disease, about 13%, which is far higher than the rate in the general population. This shows that celiac disease is a significant possibility in children with chronic diarrhea and should be considered more often. Interestingly, common assumptions like age, gender, or being underweight didn't strongly predict whether a child had the disease. However, two factors stood out: short stature and family history. Children who were shorter than average had a much higher chance of testing positive. Nearly 29% of children with short stature had celiac disease, compared to only 6% of children with average height. This suggests that poor growth, especially unexplained short stature, can be an important clue, particularly in children who also have chronic digestive symptoms. Family history also showed an initial connection. Children with a parent or sibling with celiac disease were more likely to be diagnosed. However, once other factors were considered, family history was no longer a strong predictor on its own. It still points to genetic risk, but may be less useful than signs like growth delays or chronic diarrhea when trying to identify undiagnosed cases. Surprisingly, being underweight didn't significantly increase the likelihood of a diagnosis. This challenges the traditional belief that celiac disease always leads to weight loss or visible malnutrition. In fact, children with celiac disease can appear healthy or even be overweight. So, doctors shouldn't rule out a condition just because a child looks well nourished. These findings align with studies from countries like India and Bangladesh, where the rate of celiac disease in children with chronic diarrhea ranges from 12% to 35%, depending on the study. In wealthier countries like Canada, children are usually diagnosed earlier, likely due to better awareness and access to testing. In contrast, in lower resource settings, children may go undiagnosed for longer, increasing the chance of more severe symptoms. This study's strength lies in its focus on a population where celiac disease is likely underdiagnosed. It used antibody testing to screen children, offering useful insights for local clinicians. Still, the study had limitations. It was conducted at one hospital, didn't use biopsies, the gold standard for diagnosis, and had a relatively small sample size, which may limit how widely the results apply. Even so, the message is clear. Celiac disease should be a key consideration in children with chronic diarrhea, especially if there are signs of poor growth. Weight and family history alone may not be reliable indicators. Instead, a thorough evaluation that includes height and antibody screening can help catch cases that might otherwise be missed. For families and healthcare providers, this research is a reminder that celiac disease doesn't always follow the textbook symptoms. Early diagnosis and a strict gluten-free diet can help children recover fully, grow normally, and live healthy lives. In short, about 13 out of every 100 children with chronic diarrhea in the study had celiac disease. Short stature was the most significant clue. Weight and family history were less useful on their own. Screening is essential, and symptoms should never be dismissed just because a child looks healthy. Celiac disease may be hiding in plain sight, and catching it early makes all the difference. To get the latest celiac disease news and information, be sure to subscribe to celiac.com news. Thank you for tuning in, and see you next time.